Hello, and thank you for attending my poster presentation for optimizing enteral nutrition in the ICU. My name is Arielle Belove, and I'm an advanced dietitian at Northwestern McHenry Hospital. I was the process owner during this lead process improvement project from September 2023 to August 2024. An ICU night shift nurse helped with this project throughout the year as well. The purpose of our project was to improve tube feed delivery in our McHenry ICU. The objective of our project was to identify reasons feeds were being held and to help increase tube feed delivery. We knew going into this project that there was an increase in holding of tube feeds in our ICU, leading to patients receiving less than the prescribed tube feed ordered. Adequate provision of nutrition in this patient population can help reduce disease severity, reduce risk of mortality, maintain lean body mass, decrease length of stay in the ICU, and positively impact patient outcomes. The American Society of Enteral and Parenteral Nutrition recommend meeting greater than 80% of estimated energy needs once the tube feed has reached its goal rate. Initial data showed that once patients were at their goal rate as prescribed by the dietitian in our ICU, only 63% of patients were meeting greater than 80% of their goal volume at 24 and 48 hours, and only 53% were meeting greater than 80% of their goal volume at 72 hours. This confirmed that as time went on, patients were receiving less of their nutrition prescription. A survey was provided to nurses to understand why tube feeds were being held. The most reported reason, second to vomiting, was holding for spontaneous breathing trials, or SBTs. The registered dietitian started attending ICU rounds to address tube feed volume delivery. The 5 whys analysis exercise was also used to get to the root cause of the high amount of tube feed holds around SBTs, and we found that intubated patients were having feeds held automatically at 5 a.m. in preparation for a spontaneous breathing trial, leading to prolonged tube feed holds, and in some cases greater than 4 hours. After discussions with key ICU stakeholders, specifically intensivists, ICU manager, and ICU nurse educator, it was decided to sunset this practice of the 5 a.m. tube feed holds. Education was completed with nursing staff, and a go-live date was set to stop these early morning holds. A comparison of pre and post intervention data shows a 12% improvement at 24 and 48 hours. We were pleased to find that by incorporating the dietitian into ICU rounds along with the cessation of the 5 a.m. tube feed holds, this helped increase tube feed delivery. Ongoing data collection and report out is necessary to see the true impact of our interventions. Now, months after the completion of our project, we continue to see the positive outcomes still today. The dietitian continues to attend daily ICU rounds, and we are working on a report to pull monthly data to make sure we don't fall below our control measure. Not only were our intubated ICU patients positively impacted, but this new process also helped the night shift nurses by removing one step in their workflow. They no longer had to go into the patient's room at 5 a.m. to automatically hold the tube feed. One of my favorite impacts of this project was the increased collaboration between the interdisciplinary team, specifically between the dietitians, doctors, and nurses. As dietitians, we are hyper-focused on nutrition adequacy, but I truly believe this project helps shed light on the importance of nutrition in our ICU intubated patient, and it made this topic of discussion for our entire ICU team, which was a welcomed plus from this project. So thank you again for attending my poster presentation. I hope you have a wonderful day.